Hi, everybody. I'm here today with Dr. Sally Foote, a veterinarian who practiced in general practice for 35 years and now focuses on behavior. And today we're going to talk about Calmer Canine and her experience using it with her dog, Bella. Dr. Foote, can you explain a little bit about your background and what made you so interested in getting into behavior?
Sure, thank you. I graduated from the University of Illinois in 1984 and went home to Chicago to practice for a few years. Then my husband and I had an opportunity to come back down near the Champaign-Urbana area in central Illinois in Tuscola. And there was an opportunity to buy that solo practice in a small town. And so we did. And that was how I embarked on my ownership of my own practice. And in doing so, I was able to really create the world in practice that I wanted. I wanted to have that relationship with my clients. And as I grew as a veterinarian, my interest in behavior grew because I saw how that puppy and, not only getting puppy obedience training, but how well that puppy had manners and behavior. And also with our cats really was what created that human animal bond and the relationship with the human. And that my role as a veterinarian was to not only provide for the physical health, but also to help provide for that relationship health, if you want to call it that. And so that's what sparked my interest in behavior. So over time, I would take a lot of my continuing education, not only in surgery and medicine and pharmacology and dermatology, but also whatever I could learn about separation anxiety, feline house soiling, etc. And then I really then I was also utilizing just kind of intuitively less stressful handling techniques. And it was just kind of over time and things that I became more advanced with my knowledge and membership with the American Veterinary Society of Animal Behavior that and I went to Purdue University for a long immersion weekend in behavior education with Dr. Lucier. And then I started doing behavior consultation to my community and getting referrals from the primary care veterinarians and really refining those less stressful handling skills. And I became friends with the late Dr. Sophia Yin. And we worked on some project type things through the Veterinary Behavior Association. And then I became involved also in the Fear Free program as an author on their exam room module. And after Dr. Yin's passing, then I was, the title was executive director, but the veterinarian, overseeing the operations and so forth of the company. And as all that went on, then I um, grew in my speaking opportunity and speaking, writing, webinars, presenting, article writing, and so on. And kind of came to a point where I said, you know what, I can't do this all myself. And it was difficult, frankly, to find associates to want to come to an employee to the small town. So I thought, well, if someone would buy, the general practice to keep it going, might be an opportunity for someone looking for practice ownership. And so, very fortunately, Dr. Kyla Coons, who practiced maybe 20 miles away as an associate, she wanted to own her own practice. So she bought the practice. And that was about a year and a half ago. And so at that point, then I really embarked on doing more speaking and writing and launched Foote and Friends, my Dr. Sally J. Foote website, and writing webinars like in low stress handling and emergency care and more advanced low stress veterinary care online education for the veterinary professional, but then also creating too some webinars and such and handouts for the client as behavior solutions. They can't get into consultation. And I still do provide then private behavior consultations through the veterinary referral as well.
Fantastic. Well, that's great. So, a little bit about how you heard about Calmer Canine. When did you first hear about it, and what were your first reaction to it?
Well, the first I heard about it was at the Clinical Animal Behavior Conference in the fall, October 2019. And Dr. Judy Corman made, it was like a lunchtime presentation. And so she made the presentation about the study that was done at North Carolina State University by Dr. Margaret Gruen and her staff on separation anxiety. I think this was the first field trial of the product for separation anxiety and a part of how they had the label claim, then for the FDA. And so she presented not only the science of how Calmer Canine Halo works, the electronic pulse therapy, field therapy, and how that electronic pulsing is actually making changes at the cellular level and increasing the nitrous oxide, which is the natural anti-inflammatory. So that first of all perked me up. I was like, whoa, hey, well, we're really getting into the brain science here. And when I was in general practice, I also like to be very integrative. I really enjoyed really not only knowing and understanding, but helping my clients integrate nutrition, supplement, body work, like physical therapy, body movement, as well as medication or surgery for managing health. That it's never just about a surgery and you're once and done. Just take this pill and we're all set. No, everything has to integrate together, and then the environment as well. How's home set up? Relationship between animal to animal and animal to the whole bit, right? And so there's been growing knowledge of the effects of aging on the brain, how we have increasing oxidative stress and these free radicals, etc., that cause damage and changes in the brain, and then that changes how the neurotransmitters are working, and what you see as a result then maybe behavior change. And so this was then a device that is actually like directly working at that cellular level to reduce inflammation. And so that first had me going, whoop, like this. I sit there going,
Right up to that.
yeah, I did. And so, first of all, that part had me interested. And then, of course, when Dr. Corman was showing the actual videos, of these cases that were, they're in their thunder shirt, they've got their food puzzle. So, that these dogs had a behavior modification plan. And I guess they may have been on up to one medication or something anyway, that they had also a medication plan, yet in the video, like the starting videos, you could see that they're still tearing the bed off, they're howling. So they're still having significant anxiety that can cause significant health problems too. And then, the use of the device and then the follow-up videos where many of these dogs were resting calmly. And that separation anxiety is one of those complex anxiety disorders because it's oftentimes a multi-layering of other anxieties that then kind of all come together when the animal is separated from a bonded person, a bonded animal, or the bonded environment. So that had me going, hey, I think there's something going on with this thing. And while there was actually a particular separation anxiety case with an aged dog, but they were not a very compliant client. So I was like, yeah, I don't know if I'll get them to use this. I started actually thinking of my own dog, Bella.
Yeah. Tell me a
And
little bit more about Bella's, previous history with anxieties. Was it separation anxiety, or what kind of anxiety did she deal with?
Bella doesn't have separation anxiety, but she has been a dog that, seriously, starting at 9 weeks of age, it was almost like the door shut on her brain to that open socialization and life is easy and good. She was always one that just, I don't know what, at 9 weeks of age, suddenly she was very wary, very fearful of things. I use, Doppler collar. I work closely with some of the boarded behaviorists, and I said, this is probably genetic. She's always going to be a fearful dog. She's an anxious kind of a dog. And the best that you're going to be able to do is to minimize it. She's never going to be that happy dog who will be like, woohoo, I can meet everybody. And she's a great companion dog for our family. But she's also reactive, meaning she would, I don't know what it is about yellow Labradors. my dog would see like the yellow Labrador across the street. And we're talking just, across the street. And she would fly at the window, barking and fly upstairs. And no amount of like rewarding, calling away, she could do it in the moment, but it wouldn't last. It just wouldn't last in her head. And so she was one of these kind of dogs that could go from 0 to 100. Now she improved through most of her life. Now Bella's 11 years old. And I kind of was noticing in like the last 6 months, like, man, she's getting a lot barkier and, like more readily able to bark at if another dog walked by. And then my neighbor on the other side of the house, when he would like come out of the house and get into his pickup truck to go to work. And, of course it's irritating. And so I had started, I put the paper up on the windows just to have her calm down because at 11 years old, now if she goes flying off the couch, running through the house, she could tear a cruciate ligament in her knee. She could injure herself. And, she nothing really significant, but I knew she had like at times a mildly sore shoulder. And, she's on joint supplement, she's on the calm diet, she gets some other supplementation. She had been on medication, made no difference for her. She gets regular walks. But I just thought, the last thing you need to do is like bust your body up because you're flying through the house because of your activity. So when I heard this presentation about the Calmer Canine, I thought, I wonder if part of the reason why my dog is getting more reactive is this is her response to changing brain chemistry because she's aging. Because and Hills Corporation has done this, whatever study, all dogs, their genes change at age 7.
Interesting.
So at age 7 and older, there are more cytokines. Now, this is all the biochemistry in the cells. Cytokines are released, more antioxidants because of this oxidative aging stress. In other words, brain aging is going to happen no matter what. And sometimes we see, even in terms of cognitive dysfunction syndrome, anxiety behaviors as a reflection of the brain aging. And I thought, okay, my dog's anxiety is related to people I don't know and reactivity. Maybe this is why. I'd like to do this trial on my dog.
Yeah.
Give it a go, right? And so that's how I came to using the Calmer Canine in Bella.
Tell me a little bit about your experience starting Calmer Canine treatment. What were your thoughts as you got the box and you saw the device? What did you think about it? Was it easy for you to use?
Yeah, it was really easy to use. I got it. And what I decided was this. I said, okay, I'm going to run my own little household study. So, got the device. And so, of course, I take the device out, make sure I pulled the tab so the battery works, played around with the little Velcro strap thing. I thought, okay, starting point, all the papers coming off the window, right?
Mhm.
Because that helped my dog. But I thought, if I want to really see how her reactivity is improved from just the effect of this device, I kind of want to let's take down the paper so that's not an element in here because it did reduce her reactivity because she couldn't see anything but looked like I lived in a crack house. So I didn't want that. That was my goal, right?
Yeah,
Anyway,
it's a good goal.
so kind of like taking off, let's say, to liken it to when when you go off a drug, when you remove a drug, you want no drug for a period. It's called a washout before you start the new drug. So this way you can really evaluate a new drug's effect. So that's how I looked at this with the Calmer Canine. Took all the paper off the windows. I said 5 days, nothing, no paper, no change in any supplement, no change in what I'm doing. And I want to track how much she's barking at some of these typical triggers. So I'm only going to track intensity of barking, like how many times she's barking, like is it a bark bark or bark bark like that? And then also, is she just standing there barking? Or is she jumping at the window barking? Or is she now ripping through the house like she will do at times? Ripping through the house from window to window, trying to get at this stimulus, which that literally happens like within 2 seconds with my dog. I mean, she is just, one of those rocket dogs. No matter what training you've done. Okay. Those of you out there, you know what I'm talking about, right? Okay. So day 1, not so bad, but by day 2, she was now going back to her old baseline. It was almost like she was managed, if you will, like remembered, oh, I don't bark at these things for about 1 day. So by day 5, I couldn't wait to get that Calmer Canine on her because she she was really irritating the heck out of me, and I was a little worried about you're gonna hurt yourself, because my neighbor across the way has 2 dogs and one of them is a golden doodle. So that dog was gonna be walking by 3 times a day. And my other neighbor, remember I said barking at the neighbor getting out of the truck, he still went to work twice a day, whatever, in back and forth. These things are not gonna change in my world. And I can't, she lives in this home, we live in this area. So anyway, so I think day 4, I just put the Velcro strap around the neck and the chest, I just want to know that you're accustomed to wearing this. That any change I see with you, I'm putting on the actual unit, I can differentiate. Was it because of the straps and the vest device, or is it about the unit, right? Well, so she's fine wearing the vest and the device. And then day 1, when I put the unit on, she didn't mind it at all. We had been on our walk, and so she was laying in her bed or whatever on the chair. Okay, now's the time to put the Calmer Canine on. So I just put it on, and I think I sat out in the room with her and had a cup of coffee or read or something for the 15 minutes. And I did that twice a day. And so she tolerated it well. It was easy to use. not hard to figure out or anything, and that's how we got started.
Fantastic. So did you use Calmer Canine's tracking log at all and the anxiety tracker resources that they provided, or did you use your own and create your own?
Well, frankly, I did start off creating my own little just check off box in this like kind of grid of, how intense was her body and how intense was the barking. And then I actually opened up some of the information they sent me and got the anxiety trackers and used them.
Well, and how long after you started using Calmer Canine doing the treatment with her did you notice a change in her behavior?
I pretty much by day 7, her intensity of barking, like how many barks, in a cluster was definitely reduced. And then her physical agitation was reduced for certain triggers, not all the triggers, but certain ones. So in other words, she was now less reactive about the neighbor dogs across the street. Boy, that was like, wow. And then it took a while longer for the neighbor going in and out of his truck. And I think it was just a combination of how close he was closer to the side of the house you could see him. And I think it was also about it was a large diesel engine truck, just the movement of the truck and the noise of the truck. But anyway, by day 7 and certainly by day 10, is between day 7, day 10, there was some but really real improvement by day 10.
Were you also using behavior modification at the same time, or were you only doing Calmer Canine treatments?
We're maintaining the behavior modification, which we always had been.
Mhm.
And that would be successful like in the moment, but it never provided kind of lasting benefit or really reducing the threshold. Even standing there with her, like, look, reward, trying to do that technique. She's like, yeah, see it there. I'll eat the food and then I'll still be upset. It's like, all right, your brain just does not calm down. I mean, it's just
Right.
you, right? So I did see, yes, her reactivity threshold increased. So she was less reactive. She could do more of almost kind of like bark. It's almost like bark. Wait a minute. You know what I mean? Like the stop and think or come away quicker.
Mhm.
And then actually more moderate reactivity triggers out on walks and things. The threshold had really raised on that. And then at the same time, we were getting ready to take a long trip. And because I no longer own the practice, and just some changes in the practice on the ability for boarding and this and that, it wasn't going to be a good place to board Bella because she would be with staff she didn't know. And I was like, this is not going to be good. um, Last thing you want as a veterinarian is to have your pet bite anybody. I don't want anybody's pet, dog or cat to bite anybody, but especially if you're the vet, especially if you're supposed to know stuff about behavior. So, so it was a wonderful day boarding, doggy daycare, but not the mosh pits of dogs and doggy daycare facility I used a lot for my separation anxiety cases, for treating separation anxiety. So I was having Bella getting started going there for just like 2 hours a day because she would tend to be a dog who'd be like timid, not want to eat, if she's in a setting like that. But I knew this staff would follow the protocol I would give them of she hasn't had breakfast. I want you to throw food at my dog. My dog makes friends through food, right? And I noticed while she was we had started a couple days of that. She was gradually improving, but then we started the Calmer Canine. And then I noticed like, you took her out, she played ball with you? And they said, yes. I was like, oh my God. And they even I said, take video of her so I can see, just so we're all on the same page with what we're saying. If you say she's better, not that I doubt you, but just how much better does better look, right? And honestly, they had my dog playing ball and allowing the handler to pet her. And I showed it to my daughter and she said, wow, that's really good. And I really think that was like a spillover benefit of the Calmer Canine treatment. And I've read that on some of the other cases, and especially some dogs now being easier to handle at the veterinarian
Mhm.
or not being as upset about, strangers and things like that.
Yeah. So did you only do 4 weeks of treatment or did you complete the full 6 weeks of recommended treatment?
I think we were at about 4 weeks, quite honestly. By the time we went on our trip, she was right at about 4 weeks. And I thought, you know what? This is over Thanksgiving and near the holidays and they're plenty busy. And I thought she was like now at barking just maybe like the bark. bark, like more what I would consider a normal dog bark at things she saw outside, and really doing well in the daycare. So I thought, you know what, let's just stop it now. Let's just stop it, and we'll be back in about 10 days. And then I'll see how her behavior is, if there's any relapse, and that. So we got her, no, there no relapse. She was happy. She ate well throughout boarding. And then we brought her home, and she was staying a lot less reactive. Now, in about 2 or 3 weeks later, then things started bubbling up. So I've gone back to using the Calmer Canine on her maybe about 3 times a week, once a day, 3, 4 times a week, once a day. And I chose to do that because I thought, yes, it makes sense to me. Her brain is aging. The cause, whatever, for inflammation is not gone. She's going to relapse. Just like, you put them on a non-steroidal anti-inflammatory for arthritis. So they're feeling better and they're moving better. Well, you take them off, they're painful again because the arthritis is still present. You're not treating the arthritis. You're managing the pain. You're reducing the intensity. So you keep them on the med. When they're doing better, you don't remove them from it. And in her case, I felt like, well, that I think it makes sense to me medically. So actually got her back on it, and she's back to her improved level like she was back, after the first 4 weeks with twice a day therapy on it.
That's great to hear. It's
Mhm.
fantastic. So, is there anything that surprised you the most about this Calmer Canine device and the effect it had?
We think. I think it's effectiveness. Not many medications are going to have like the mental state, the drug or even the supplement is going to have the mental state of an animal have a significant improvement in as quickly as a week to 2 weeks. And then also that spillover benefit without having done any specific behavior modification for that other trigger setting. And I talked to a different trainer in Florida who had her case of a dog that was anxious about car rides, and I think also anxious, maybe inner dog aggressive, anxious around other dogs. And she'd been working with a client and making some improvements. And then as a trainer, saw the Calmer Canine and said, well, why don't we at least maybe give this a try, see if this would help at least with maybe the car rides, because the dog was already agitated then coming into training class from the car ride, and all the things the client was trying to do was not really making much, of an improvement. So the client was using the Calmer Canine on the dog. So the dog was coming in a much less anxious state for training class, and then in training class did a lot better. And and then, as it turns out, I think the dog had an ear infection or something that needed a veterinarian, and typically would need multiple medications for like partially sedating the dog because he would be agitated and aggressive at the veterinarian. And I don't know if it was because of urgency or what, but the client took the dog in without the medication, and they were able to do the exam and care on the dog, which shocked the staff. They've never been able to approach the dog or touch it like that. And then the owner said, well, I've been using this Calmer Canine product for a few weeks, you know, and they were like, well, that's what's making the difference, because you have not brought the dog in for like happy visits. We've not been doing a bunch of like rewarding to come in, because the dog's been so difficult to bring in. You couldn't even get the dog started at that level. The dog would always have to be really sedate, and then that's time and all that. So I think what really surprised me was starting to read, and like I said, and even in my own dog, I'm thinking, I think she's doing better at daycare because of this Calmer Canine. But I wonder. But then when I'm talking to other people who've used it, hearing the same thing,
Mhm.
these other like co-anxieties improving without specifically working on those co-anxieties, and you don't get that often with the drug therapies. Usually the drug may help, but you usually still have to do specific training for those other co-anxieties to really get a significant clinical or appreciable difference.
Mhm.
And at least for the cases that I've encountered, people weren't doing that specific behavior modification for those things, but they were seeing significant improvement. And that's important, because so often people get very overwhelmed with the amount of work it may take, and changes in the environment, changes in your own schedule to help an animal with one behavior problem. And that's why you usually kind of prioritize which one are we going to work on, or maybe just a little bit in this problem, a little bit in that problem. And in this case, it's like working on the one, we got more improvement on the others, which is better for welfare, and it's really better for that human and animal, relationship as well.
What kinds of cases would you recommend using Calmer Canine for besides separation anxiety?
I really think we should be trying it on a lot of these reactives.
Mhm.
I think our reactive dogs, I know I've had my personal experience with Bella. And then this other, I haven't had a chance to actually get on the phone with the veterinarian. That dog in Florida was difficult, but just based upon through the written history, whatever, from the trainer and I think the owner, it sounded like that dog was also reactive. That these reactive dogs really do see a benefit. I definitely think for our reactive dogs, because again, they're another more intense kind of multifactorial um, the reactivity is a response. It's a response that is blending both their genetic makeup of their brain, their body response, and actually usually kind of this immediate triggering up of a lot of co-anxieties, co-threats. That is why they can't stop and think and assess very well. So I think definitely the reactive dogs. I think noise phobia, noise fearful dogs, it would probably help them a lot, and cognitive dysfunction syndrome. A lot of our old dogs over the age of 7, I think if there's any starting to see an uptick in any of these anxiety issues, I would definitely use a Calmer canine. I think
Right.
that is really a big, those would be the categories I would consider right now as being where it would be most successful. And plus tracking the response, tracking, like doing some more studies in those, even if they're field studies and they're not necessarily double blinded or placebo controlled, at least even getting a field study or getting enough like of a group, if we got 20 reactive dogs and 10 were treated, in a traditional way, let's say, with med and desensitization, counter conditioning, and avoidance management, then we have then the other 10 that are also treated with the desensitization, counter conditioning, and avoidance management. And then we add in the Calmer canine, maybe one med, like the separation anxiety case. And then we add in the Calmer canine, and then we track intensity and frequency and the reactivity thresholds and
Mhm.
compare the two. Because that's really, there are a lot of dogs out there that are reactive. They, like I said, that the dog is great 90% of the time, but that 10% of the time is a huge problem. And these dogs can be dangerous. If there's anything that gets them to just kind of help them mentally slow down, you know,
Mhm.
um, I think it is worthwhile to investigate, and it's safe. It's a safe product,
Mhm.
you know. Lastly, I would also say that and this is probably again getting back a little bit more to the aged dog, but when you have an animal that may have concurrent health problems like diabetes or hypothyroidism, or because any body inflammation is going to shower the brain with junk. That's the easiest way to say it, with those inflammatory byproducts, and that ages the brain. And so the Calmer canine is helping to do some reversal of that. Yes, there's supplements. Yes, there are other, no drug directly that helps to reduce the brain aging. It's managed. But because these animals may need to be on other meds, like a pain relief medication, or maybe a thyroid, hormonal supplement medication for managing a disease, then a device like this that is coming in to give therapy without having drug interaction, or then any other kind of interaction that could complicate like nutritional management and such, I think is definitely something that'd be very worthwhile to also investigate and look at.
Yeah, I think it's a great idea. Um, you mentioned how it's a safe product, so I'd like to kind of explore that's something that since it's so new, a lot of people are a little worried about, well, what is this? Like, what is the technology? How does it work? Does my dog feel it? What are your thoughts on how you would explain to a client that you'd like to try Calmer Canine? How would you introduce that to them? What would you explain to them on how it's used?
Well, what I would explain to them is that, in that loop halo device that there's a pulse of an electric charge, and it creates this magnetic field that is sensed by the cells over which this loop is laying. And so, yes, well, he's got a thick skull, he's got a bone, yes, but it does go all the way down to the brain. And so, electricity changes chemistry in the brain, similar to how drugs change chemistry in the brain. And in this particular case, we may not, either we're already using a drug or we're not seeing enough benefit, and to avoid the side effect of increased drugs or lots of different drugs, we're going to add in this electromagnetic therapy as an adjunct, as a second beneficiary to drug therapy. And so that'd be one way I would explain it. Okay. So, because it's going to help with the drug benefit and its own benefit, because they're all both working at that chemical level at the cell of the brain tissue. If they weren't already on medication or drug, and maybe for whatever reasons I don't want to use a drug, or I feel like this may be more effective than some of the drug therapies we've seen, and I'll explain it the same way, just that we're starting off with this electromagnetic therapy device, because in a very gentle way, it's making those chemical changes in the brain cells that are what control the brain's response. The brain is responsible for all of our bodily functions, not just how we feel, but also how we act. And behavior is a combination of both. Behavior is a combination of how your body acts, along with what you remember, your memory, and your emotion and their emotion. And so that's how I would explain that. And the safety would come from that, because this device has been tested a lot in animals, and actually quite a bit in humans, and that we can see and measure that we do not have any deleterious changes in the blood chemistry or things like this from the use of it. That's part of how we can measure safety. And that even relating back to some of the human studies as far as comfort and how do you feel when it's being used, I was reading up on some of that with some of these PMF devices on the human side, is that once they determine the correct frequency, which Calmer Canine is, it's a different frequency than what are called the loop devices used for more neuromuscular inflammation, that they did not have any headaches or, feel anything differently mentally from it. But you saw the benefit of how they could function, how their brain could function, how they could think.
So, getting back to Bella and your life, how have you felt it has improved your quality of life? How are you feeling about her day to day now with her reactivity after Calmer Canine treatment?
I feel a lot better because I got the paper off my windows.
Yes.
And while she will do some barking, I mean, there's no way that's not gonna happen, that she is not flying through the house. So I am not as worried about her doing anything to hurt herself, from having that sudden eruption and wanting to just go running through the house. It's not as irritating. I'll just say it. It's really irritating to have a constantly barking dog. And I think she rests better. She sleeps better. She's also kind of more social to us. She wants to be petted more, she wants to hang out with us more. And she's just not like the reactive dogs. So the dogs are often described as always being on. What's that? What's that? What's going on? Right? They're always scanning the horizon, always looking out for everything. They really don't enjoy like sniffing the ground so much when they walk, just having that, it's a nice day. And now I see my dog able to do that. And I think that is it's improved quality of life. I think it's improved her quality of life, and in turn, then it improves our quality of life.
Fantastic. So, what's the main thing that makes you want to recommend this device to owners of anxious dogs or reactive dogs?
I think the main thing is its effectiveness. I see the effectiveness in it fairly quickly, and having a product that can minimize a lot of risk of drug interaction. I use drug. Okay, please don't get me wrong. I do use medication. I do use drugs, but I guess I would be a little bit more of a drug light veterinarian than a drug heavy veterinarian. And the reason for that is that we don't have a lot of safety studies about drugs in veterinary medicine, and many of our drugs, let alone the psychotropic drugs. So while there has been a lot of anecdotal use of it and case use of it, I have also seen where a drug has gone the opposite way. I've seen dogs on and cats on alprazolam, for example. They've become more agitated or more aggressive. And as a veterinarian, we take an oath to do no harm. So just like any other medication, if I'm like, oh, this medication may be good, could increase seizures, and I have an epileptic. Do I want to use it? I don't think so. So if I have an animal with, say, high anxiety, might this drug possibly have an opposite effect? And if there is that, possibility, which actually quite a few of our drugs do have that, it may be a low amount, but hey, when that case is 1 out of 10,000, it's 1 out of 100, it's 100 out of 100 to you. Anyway, we have not had reports of that with a Calmer canine be causing more agitation or an increase in anxiety or increase in aggression. So that part of the safety is very appealing to myself. And then, of course, it is easy to use, especially now that there is that, Velcro neck wrap, chest strap thing, and that. So I think ease of use, safety, and just avoiding some of the potential complication with multimodal drug therapy. Like we can now have this with drug therapy, or maybe instead of drug therapy, and avoid some of those potential complications one can find from drug therapy. And that's important to me.
Is there anything else you'd like people to know about Calmer Canine, or anything that we didn't get to talk about so far?
So one of the things I really want clients to understand or know about the Calmer Canine is that it's not some voodoo, funky little weird thing like a divining rod or something. It actually is a device that is delivering a therapeutic change in the tissues of the brain that aids or improves the mental health state of an animal. And that we want to continue use of this and knowledge of it and have more cases in it, because we have also because it does help with avoiding side effect of drug or helping a drug they're already on to maybe work better. And then lastly, many of our pets are living a longer life. They're living to older ages. I mean, when I graduated 35 years ago, a 10-year-old German Shepherd was considered old and oftentimes was time for euthanasia. And now I'm seeing German Shepherds getting to 16 or 17 years old. It's a 70% increase in a lifespan. So now that they're living older, we are seeing some of these anxiety related issues that maybe are related to, say, chronic pain, or other physical issues. But blended with that, something like the Calmer Canine could help if that old dog was having now a problem with thunderstorm fear, noise fear, or separation anxiety that they didn't have before. And so the combination of using, say, the Calmer Canine while treating a hypothyroidism state or Addison's disease or whatever could give the benefits not only for the behavior but the quality of life of this aging pet. So I think for all those reasons, I feel pretty strongly about veterinarians and pet owners knowing and understanding that this is a therapeutic device, safe to use. It may not be the answer for everybody, just like there is no drug, there is no treatment that's the answer for everybody. Yet it really opens up a whole nother arena of therapy that can give aid and can be a combined device. Again, going back to that integrative approach, it doesn't have to be all one or another. And that we are, embracing this kind of more whole body health concept, because I just really see how that ties in with it as well.
Yeah, fantastic. Well, thank you so much for joining us today to talk about your experience with Calmer Canine.
Okay, well, you're welcome. Thank you.